I'm Dr. Mike Sr., chiropractor and the Alkaline Health Coach. Today I wanted to respond to a question I get asked very often, especially here in Europe, is the difference between a chiropractor and an osteopath. Okay, they're similar but not the same. Okay, a chiropractor, let's go back a second. The chiropractor and osteopathy started in about the same period. Chiropractic in 1895, and osteopathy about the same period, okay? But a chiropractor finds a subluxation and frees that up, okay? Freeing up the subluxation frees up the nerve that passes on the left or the right side. These nerves are used to communicate, the brain to communicate with the organs and the organs back to the brain, okay? All the nerves pass through the spine except for 12 cranial nerves, but all of the nerves pass through the spine. Okay, so a chiropractor's job is to find if there's a pinched nerve in the spine, free it up through an adjustment, and turn the lights back on. So reconnecting the brain with the body with the brain. Very simple. Okay, I wanted to show you real quick an example of the anatomy. Okay. This is two lumbar vertebrae, okay? A disc between the two, like all the vertebrae in the spine, they have a disc between them, okay? This allows the spine to move. Then on the left side and the right side, we have a nerve that comes out, okay? In the canal, we have the spinal cord, okay? So a vertebra can be out of place or locked up, we call it subluxation. Pinches the nerve and diminishes the communication between body and brain and body. Osteopathy, from its origins, was to free up the microcirculation, okay, sanguinea, or blood, the microcirculation of the blood, okay. They use a technique, it's called SOT, sacral occipital technique, okay. In America, the founder of it was Desjardins. In Europe, I noticed they use a different French name. I haven't gone to study what the difference is between the two, but the technique is that. Originally, Desjardins was a chiropractor, okay? But I don't know at what point when it deviated and when it became this difference between osteopathy and chiropractic, but it did at one point, okay? So they find with the SOT technique that when one is breathing, the occiput and the sacrum oscillate in a certain harmony, okay? If it's not, there's some block somewhere in the spine, in the cranium, in the pelvis that is creating this, it's not in harmony, this movement here, okay? So they go out and free that up, okay? I notice in Europe, they're a little bit mixed between the techniques, but the base and the founding of it, or the approach is this, okay? One frees up the blood, microcirculation of the blood, the other one frees up the nerves, chiropractic, okay? We're a little bit, well, there's 100 different chiropractic techniques, probably even more than 100. Some are fairly invasive, some are less invasive when we adjust the subluxation, okay? I use the classic adjusting techniques, Gonstead, diversified, activator, which are pretty much the ones that I use daily, okay? Osteopathy uses that SOT technique, okay, which is a little bit less invasive, it's more on the lighter touch, okay? But I just wanted to address this because get this question asked very often, okay? In the United States, an osteopath is a medical doctor that has specialized, okay? Chiropractor, no. Even though they studied pathology, they can't do microsurgery or can't prescribe pharmaceutical drugs, okay? But they both studied pathologies because it's important they're able to diagnose between, you know, a plastic bag and a paper bag, but mostly orthopedic problems. Okay, in Europe, I don't know, I haven't looked at the curriculum, I don't know what their curriculum is in osteopathy. I know it's a long road also for them, okay? I hope this was useful. I hope this was informative for you. If you have any questions or you want to clarify anything that I made a mistake on, feel free to put a comment in. Or you can contact with Messenger or the email. Okay? I hope this was informative for you.